One of them focuses on the provider perspective. So we have talked about how childcare is a critical pillar of our economy. It lets parents go to work knowing that their babies will be cared for. For decades, though, the United States has just underinvested in childcare, essentially crossing our fingers and hoping that families will find a way to figure this out. But families can't do it because, as you have explained, Ms. Colagrosso, the numbers just don't add up. In many states, the cost of childcare outstrips the cost of college. Many parents are already priced out of childcare, which makes it cheaper for them to stay at home. And those parents who are scraping together enough money to pay for childcare simply cannot afford to pay another dollar more. Meanwhile, childcare providers are clearly not getting rich. The fees may choke parents, but they are barely enough for childcare providers to make it from 1 month to the next. And one way that childcare providers have kept this going is by paying childcare workers the absolute minimum that they can. Not because they're trying to be mean to childcare workers, but because it's the only way they can try to hold this together. And the consequence is childcare workers leave every year. Even before COVID, about 30% of childcare workers were leaving the field every year. Add this up, and we just have a massive shortage of childcare that is getting worse and getting worse and getting worse. So, Ms. Colagrosso, you've run a childcare center in West Virginia for almost 30 years. I know that you know this issue. Are you able to serve all of the families who come to you looking for care?
No. We have waiting lists for every age group, all the way from infants up through school age. Some of those are months long. I regularly, on a regular basis, have somebody call who has a new job to start, and we can't help them. So they have to turn down the job.
So the need is vastly outstripping the supply in your area, and we know the numbers show that's true all around the country. So let me ask the question, could you just raise wages so that you could provide more childcare slots?
Yeah, I'd love to raise wages because ultimately that's, the people that work for me deserve that. But I couldn't raise the wage of the subsidy. That takes somebody a higher pay grade than me.
Okay, so let me just stop, make sure everybody understands what you're talking about. If the family is of low or moderate income and the government, either state or federal government, is helping subsidize, that amount is already fixed.
Yeah, we don't get to decide that amount. That's a daily rate.
That's for us to do.
For contract, right?
Okay.
And so then if I had to raise the families that are outside of subsidy that much, I couldn't raise it enough to influence my employees' wages and still have people be able to afford it.
Right.
People that our community would not even be able to afford the child care at all, which is some of what you're seeing across the country. Right. People just say, I can't afford it, so I'll just stay home.
Yeah. And let me ask you just one more, just to give us a little more flavor around this. How do the wages you pay compare with other entry-level jobs in your region?
They're much lower, unfortunately. I can't pay as much as Sheetz. That's the convenience store down the road. They're paying $18 an hour for entry level. Before the pandemic, I hired in entry level employees at minimum wage, which is $8.75 an hour in West Virginia. Now, just as Mr. Roman mentioned, that we have to offer a little bit more, so I'm offering $12 an hour, but I'm really not able to afford that. So when the relief money's gone, that won't happen. That's just because I have some relief money to get people in the door.
So working at a local convenience store pays more than you can afford to pay the people who are taking care of our children.
Correct.
I think it's clear that childcare workers across this country are shamefully underpaid, and the providers are barely staying afloat. This is a broken system, and the only way it's going to get better is if the government steps up. So let me ask you about one more piece in this. West Virginia has a preschool funding program. So, Ms. Colagrosso, that means you get significant government funding for one part of your business. So does that mean that you can afford to pay those teachers more and that you're able to retain them?
Absolutely. In West Virginia, we do a contract to collaborative program. So childcare and public school work together. And so I do get that public education dollar, and that goes directly into the staff, the employees. So I pay that teacher and that aide equivalent to the kindergarten teachers in our county.
And does that mean you have more teachers and less turnover?
Just for that classroom.
Just for that.
Right. Unfortunately, the others, the infants and toddlers and 2-year-olds and 3-year-olds, they don't see that additional funding. But my
So then
pre-K
let me
program
ask it that
does.
way. Would it mean if you had federal assistance to be able to pay your staff equivalently for taking care of 3-month-olds or 2-year-olds?
It would be an incredible improvement in the child care program and the quality. The number one determiner for infants and toddlers of quality is the same person, consistency, low turnover. They need to make those bonds with the people that are caring for them, and the families need those bonds, but infants especially and toddlers.
Yeah. Thank you very much. And thank you very much for the work you do. It's critically important work, and I just want to see us support it as we go forward.